I was just sharing with the sheriff that, there aren't a lot of business organizations doing panels and forums on this topic, and yet it impacts us as businesses every day, whether it's one of our employees, their family member, whether they're in the addiction situation themselves, or a victim of something that happens because of it. So all of our businesses have a stake in helping to resolve this issue and support our community as we go through it together. I'm thrilled to be able to introduce our first panel today. We have 3 great speakers, and we will bring them up one at a time to speak from the podium, then join us in a seat. So our first speaker is Nick Yacoub. Nick, come up and join us. He is a certified recovery specialist with the Fairfax Falls Church Community Services Board. He is in long-term recovery and has been there for 10 years. He is a native of Fairfax County. Come on up, Nick. A native of Fairfax County. He went to Langley High School like I did, so I think he's brilliant. And also went to Northern Virginia Community College, and then also George Mason University. He loves camping in the outdoors. I'm going to send you over to the podium, and thanks for being here, Nick. Let's give him a welcome.
So my name is Nick Yacoub, and I'm a person in long-term recovery. And what that means for me is I haven't used any drugs, including alcohol, in over 10 years at this point. Thank you. As a result of that, my life's gotten a whole lot better. Opioids, heroin is a part of my story. I got into recovery when I was 21 years old as a result of an arrest in Loudoun County. I don't like to focus too much on what happened necessarily in terms of what my using was like. I started using when I was 10 years old, prescription pills in high school, heroin and other drugs, 18 and 19 years old, was arrested, and a lot of my illegal drug use funneled into alcoholism. And, that's really the long short of it. 21 is when I actually got into recovery. And it was pointed out to me that as long as I kept doing the same things, I was going to keep getting the same results. It was a person in the recovery community that pointed that out to me. And I wound up leaving that brief stint of incarceration and going into a treatment program out in Lynchburg, and went through the motions and everything like that, and had gotten hooked up with the recovery community. This is a group of people who have been in recovery for various lengths of time. Some people it's a couple of months. Some people it's multiple years and decades. But the key thing they gave me was hope. I didn't think that my life was ever going to change. I thought I was doomed to an existence of using drugs, broken relationships, being unemployable or borderline unemployable, having hard times with family, constantly, just living paycheck to paycheck when I actually could get a paycheck. That's seriously what I thought my existence was going to be. And, the recovery community gave me hope. They gave me a reason to continue going on. And the biggest piece of that was going out there and finding other people to help. And I learned that was a key tenet of recovery, and it gave me the will and the purpose to actually try recovery. I wasn't convinced that this was going to work for me. I graduated from there. I went back. I was on probation in Fairfax County, and my probation officer actually sent me to the Fairfax Falls Church Community Services Board for an evaluation. I now work for the Fairfax Falls Church Community Services Board, so it's kind of cool how my story has come full circle, being a consumer and a client of those services, and now today I actually work for those very same services that helped save my life. I went to a 90-day treatment program in Chantilly, Virginia called The New Beginning, one of the sites I work at today, which is awesome. It helped me deal with a lot of the skeletons from my past. I had a lot of trauma throughout my life. I had a lot of issues that were working in tandem with my drug use. Depression, anxiety, lost my best friend to a heroin overdose at the age of 19. Known a lot of people that have passed away as a result of this disease, either directly or indirectly. But they taught me the coping skills and tools that I would need along with the recovery community, and they sort of gently pushed me out there to go attend support groups, to work with other people that also had a program of recovery. And after I graduated, I went to a supervised living program, also with the Fairfax Falls Church Community Services Board. It was called Steps to Recovery back in the day. Now it's called The New Direction. And I had a very wonderful counselor there who really didn't cut me a whole heck of a lot of slack in some regards. She was like, you know what? I don't care that it's 2008. I don't care that you're a convicted felon. I want you to go out there, get a job, start paying your treatment fees. You need to keep going to your support groups, all that sort of stuff. And I was just kind of like, all right, let's give this a shot. And people showed me all kinds of amazing things. Accountability, integrity, honesty. Being able to carry myself with dignity. We talk about substance use disorder, and I purposely use that term because that's the actual clinical term instead of the word addiction. Okay, we're all familiar with the word addiction. It carries a very negative connotation, and unfortunately, this is my personal belief, and I know there's a lot of people out there that'll reaffirm this. People labeled addicts, alcoholics, they're considered a disposable population in a lot of ways. That's the preconceived notion that a lot of people have in the back of their head. That's the stigma of this illness. My people, ordinary, everyday people afflicted with this disease, we are not a disposable population. Period. Thank you. So anyways, I went out and I got a bunch of jobs. It was 2008. It was the height of the recession. Here I am, a convicted felon, awaiting more felony convictions in another county, thinking there's no way I'm going to get a job. And I didn't find one job. I found 3 jobs. And this was thanks to the counselor that pushed me and to the recovery community at large saying, you know what, you can do it. We've been there. Okay, we've been there, done that, got the T-shirt, sold it on eBay. Okay, if we can, so can you. And they weren't the greatest jobs in the world. I was a barista. I know a lot about coffee. It's really awesome. But anyways, so I did all that, and then 17 months of recovery. I graduated from the program, and my relationships with my family have come back together, and I'm actually paying taxes and stuff like that. It's kind of weird, And I go in front of the judge, and he says, Mr. Yakub, I'm so glad you've turned your life around. You're going to have to serve some jail time anyways. And that was a beautiful, beautiful gift because it taught me that I could practice the principles of recovery regardless of what my outside circumstances were. Even incarcerated for a year, I could continue to carry the values of honesty, open-mindedness, willingness, patience, love, tolerance, compassion, generosity behind bars. I mentored other guys, sometimes my age, sometimes twice my age, and told them, guess what? When you get out of here, because this too shall pass, there is a better way to live out there. I also did a lot of push-ups and sit-ups. I was in the best shape of my life after I got out of there. I left incarceration and, was immediately welcomed with open arms by people in the recovery community. And decided to go back to school, went to Nova, graduated from there, went to George Mason University, got a bachelor's of science in psychology, and started working as a peer recovery specialist for an organization called the Substance Abuse and Addiction Recovery Alliance. I started as a part-timer there, and I am now on their board of directors as their Northern Virginia affiliate. I started doing contract work with the Fairfax Falls Church Community Services Board. I started working with Loudoun County Mental Health. By 2016, I was elevated to the regional supervisor coordinating peer recovery specialists across the 5 counties in Region 2, Fairfax, Loudoun, Prince William, Arlington, and the city of Alexandria. That contract ended, but I continued doing the exact same work that I was doing, and the Peer recovery specialists we had dispatched to the other counties, they loved the work so much they asked us to sign on with another contractor. We did so until funding dried up for that. And then eventually I became employed by the Community Services Board directly. I want to talk briefly about some of the gifts of recovery. Am I running short on time or am I good? Another minute or two? Cool. So, no one actually wants to get into recovery if they think that their life is going to be over from this thing. That was my number one concern, 21 years old, getting into recovery. I'm 32 now, and I thought my life was over. And the big thing that I was taught was that it's possible to have fun in recovery. And as a matter of fact, I've had more fun in recovery than I ever did drinking and drugging. Regardless of the substance. This year I've been skiing. I went whitewater rafting in Class 5 rapids, which is awesome. I'm getting ready to go on a camping trip next weekend. I'm throwing a recovery-themed EDM show at George Mason University. EDM is electronic dance music, by the way, so raves, typically an environment associated with mass consumption of drugs and alcohol. This is a sober rave. We've done this twice already. We're doing the third one at Mason in Northern Virginia for the first time. And the first few times we had 400 and 200 people at this event, all in recovery, all from the recovery community, all young people, mostly between the high school and college years up into their 30s. Having a good time, having fun in recovery, no booze, no drugs around. So I'm pretty excited about that. I've gotten to do a lot of really cool things in recovery. Is it time for the word of the day? Are we doing that, or is that later? We'll get to that? Okay, cool. I want to leave you all with something, and that is recovery is possible. If you're out there struggling, if you know someone else who's out there struggling, if you're a family member of somebody with this disease, there is hope and help available, okay? The end of the road does not have to be a casket. It doesn't have to be long-term incarceration. It doesn't have to be any of those things, okay? There's a beautiful life awaiting people with this disease, provided they're willing to put in the work and ask for help. If you're out there and you're struggling, go out there and find the recovery community. If you're a family member or loved one, there are people that are recovering from that particular predicament as well. Go out and find them. Thank you, guys.
Thank you. You can just leave that. We'll have you come sit down. And next we will welcome up to the stage another great member of the Fairfax Falls Church Community Services Board, Chayla Clark. Chayla is a behavioral health supervisor in the Residential Treatment and Support Services Group, again at the Fairfax Falls Church Community Services Board, where she has served for 15 years. She is a graduate of George Mason University, has a master's from Argosy University, and is a native of the area. Please welcome Chayla Clark.
I'm going to share a little bit of information about Fairfax County specifically. During my experience with the Fairfax Falls Church Community Services Board, I have witnessed many challenges with substance use disorder, which includes the opioid use disorder. Drug overdose is a large and growing health crisis, public health crisis in the U.S., Fairfax County included. I would like to share some data about the scope of the problem in Fairfax County. Between 2014 and 2016, there were 199 opioid deaths in Fairfax County. The figure exceeded both motor vehicle and gun deaths, which were 137 and 127 respectively. I think that it is important to note that motor vehicle accidents and gun deaths have not changed in the past decade, but opioid deaths rose substantially over the past 3 years. Among the youth in Fairfax County, painkillers are the third most commonly used substance right after alcohol and marijuana. Another point, in 2016, young people ages 15 to 24 were seen in ERs or emergency departments for overdoses more than any other age group. Now, with that said, I want to also say that there is no typical opioid user. Okay. Overdoses and deaths occur in all age groups and are equally common among men and women. So you hear some of those facts, you're probably thinking, so what is being done? The Fairfax County Board of Supervisors adopted a comprehensive strategy to help save lives in our communities. For example, the Board of Supervisors requested that an opioid task force provide recommendations on how the county should address opioid misuse in our communities. There are two key goals that drive the county initiative. They are reduce the deaths from opioids through prevention, treatment, and harm reduction, and use data to describe the problem, target interventions, and evaluate effectiveness. I wanted to add in that I am pretty hopeful. I noticed that some progress is being made. A lot of times we talk about the opioid crisis and it's very negative and it seems like there's no way out. However, I wanted to mention that the CSB, the Community Services Board, expanded the medication-assisted treatment and has reduced the wait for residential treatment by 50%. It's awesome. It's awesome. There's also Revive. I'm not sure how many of you have heard of Revive. I do have some information for it, but Revive is a training that offers a free 1-hour opioid reversal course. We offer it across the county and also at the adult detention center to inmates so that we can help reduce overdose deaths when the relapse, when at release, when the risk is very high. Over 1,300 people have been trained so far, and it is rising. As I wrap up, and I didn't provide information for everything, but as I wrap up, there is more to come. For example, we have a peer support pilot program in emergency rooms, strengthened partnerships with pharmacies for the drug take-back program, and an expanded reach of messaging. I think it's very important that the community becomes more aware of the crisis and become educated on facts. Okay. On our information table, it's to the left of me, it's on the gray table. We have various handouts that I really encourage that you pick up. Some of the information provided includes the unseen impact on Virginia's children. It's a very cool handout. Signs of opioid use, signs of opioid overdose, and then information about the Revive trainings and how you can attend. And then lastly, we have information about safe disposal of your unused medications. So we actually have bags where you can take one if you like. So that's all I have for us.
Join me in thanking Shayla Clark. So I want to welcome up our next speaker, Loudoun County Sheriff Mike Chapman. He was elected sheriff. Go ahead and give him a round of applause. He was elected sheriff in 2001, took the oath of office in 2012, and started his second term in 2016. He directs operations for the largest full-service law enforcement office in the state of Virginia, the largest sheriff's office in Virginia, which handles countywide enforcement, jail, and the court system. He employs about 800 people, serving 350,000 residents over 519 square miles. He's had amazing success. In his first term, he expanded the drug abuse resistance education DARE program into both elementary and middle schools. A cold case squad was established, enhanced media outreach, professionalizing the human resources area, improved training and accountability, a county-wide internet safety training program for parents and then students as well, and a special partnership on drug awareness with the DEA. He also partnered on a no texting and driving campaign and helped integrate mental health services and initiated a crisis intervention team training. Along with many stakeholders, including Congresswoman Barbara Comstock, he initiated the Heroin Operations Team, or HOT team, which he's going to talk about today, in response to the growing national and local heroin problem, which addresses it through targeted enforcement, education, training, prevention, and rehabilitation. He's also served on the Governor's School on Campus and Safety Task Force, the National Sheriff's Association, Major County Sheriff's Association, Virginia Sheriff's Association. He graduated from the FBI National Executive Institute, Law Enforcement Executive Institute, Virginia Department of Criminal Justice Services Executive Certification, and has published many, many articles. Before he came to Loudoun County and was elected sheriff, he worked for Howard County, Maryland's Police Department in several divisions, the Drug Enforcement Administration, where he served in many different roles in Northern California, in Korea, and many other assignments across the nation. And as a subject matter expert, served in overseeing global security and law enforcement with Booz Allen. He has a BS degree from the University of Maryland and a master's from Troy State. Let's welcome Sheriff Chapman.
Thank you, Catherine. Good afternoon, everybody. Really, it's an honor to be here. I do appreciate the Dulles Regional Chamber of Commerce for inviting me today. I'm honored to be part of this panel. As you know, this is a huge problem, the opioid epidemic, and I would say it's an epidemic. I can tell you I spent 23 years in the U.S. Drug Enforcement Administration, lived all over the globe, and I never saw as many overdose deaths in the time that I was in that job as I've seen the last year. Last year, you had 64,000 people died from overdoses in this country, 64,000 people. You had more people in Virginia last year that died from overdoses than in traffic accidents, and you actually had more people that died in fatal car accidents as a result of drugs than alcohol, and that happened last year. That's the first time that's ever happened. So we started seeing back in about 3 years ago, we started seeing this gravitation towards this heroin again, and we're really quite concerned about it. So I did get a chance to partner up with Congresswoman Comstock and kind of go over like who all the stakeholders might be that might have some input in what we might be able to do to try to get to the bottom of this problem. And as you can see, we developed the heroin operations team. And what you can see from that is just a compilation of many stakeholders, everything from prevention to mental health treatment to substance abuse treatment to our community services board, partnering up with the schools, trying to do as much as we can or as much as we could to try to get to the bottom of the problem rather, and develop a program, a collective effort to try to really address this. Over time, you've seen this heroin problem evolve into an opioid problem, and it's both right now with fentanyl and carfentanil. I actually go to our DARE graduations, and I remember talking to the children at a DARE graduation, and I did bring up the fentanyl issue and that there's a new thing out there called carfentanil, and I had just read the day before in the Washington Post they described carfentanil as elephant tranquilizer. So think about that, how devastating that is. If it can knock down an elephant, imagine what it can do to a human being. And that's now some of the problem that we're having with fentanyl. So I finished my presentation, and then I actually had a veterinarian, one of the parents, come up to me after and says, "You can't mention that thing about the carfentanil anymore because they don't use it anymore as an elephant tranquilizer." And I said, "Well, why is that?" And she said, "It's because it was killing the elephants." Okay, so these are the kinds of substances that people are ingesting, okay, and it's that bad, and it doesn't take long for people to overdose. We decided to stay with the acronym HOT because if you look at if we went with opioid operations programs, that would be OOPS, and we figured that HOT would be a lot more dynamic of an acronym than that. But we looked at this as what we could do in several different categories. One is prevention, and that's the most important, I think, is to try to stop this problem before it starts. So what we did was we partnered up and, with Nick and others that I see in this room and getting together and having forums. And was able to get the DEA to move their traveling museum out to Loudoun County for about 6 months, and we were able to hold forums there and educate people with regards to what the issues were with drugs and what we could do to try to stop it. Had forums where people actually opened up, talked about their issues, their concerns, what we could do to not only prevent the problem, what we could do to help treat the problem, give people the direction that they need, and that's something that carried over as well into our adult detention center, because we're very concerned about reentry programs. We want to make sure that people get the help and the assistance they need while they're incarcerated, because I look at success as non-recidivism. I look at it as if we can put somebody through the system and they don't come back. To me, that's a real win. And what we try to do is everything that we can to give them the resources and the assistance and the direction that they need to be successful when they walk out the door. So that's very, very important to us. We actually partnered up. We had Project Purple with former National Basketball Association star Chris Herron. Sorry, I'm getting confused here. And he came out and spoke to a lot of our youth out there. We had a high school auditorium full of children that were out there, and he had a major impact on that. We actually employed Narcan. We were the first to get Narcan for all of our deputies out there. We started out with a pilot program, and quite frankly, Fire and Rescue was not that supportive of it, because they looked at it as maybe we're going to be encroaching on what they do, which is out there rescuing lives and all that. So we decided to start it out in the western end of the county, and in doing that, just to see where we might get to a scene before Fire and Rescue does. And we found almost immediately, within just a couple months or whatever, we saved 5 lives by administering Narcan. We expanded that to all of our deputies out there, and as a result of that, saved additional 21 lives on that. So we're doing everything that we can on the prevention side and the education side. One of the things that we had also done was, and this was before all this started to evolve, was expand our DARE program from the elementary school and to continue it on into middle school, because that's really when people start feeling the peer pressure and they start getting bad information and they start believing their friends. And we wanted to make sure that they would actually not buy into that, and that they would get the education that they needed. So we're working hard in many areas on a prevention and education segment of this. Enforcement is really what we do in law enforcement. That's really our job. And so what we decided to do from an enforcement standpoint was to expand what we do as far as charging people when it comes to suppliers of these drugs. So now we're partnered up with the high intensity drug trafficking area group out of Baltimore and Washington. And what we decided to do was to do everything that we could to prosecute to the fullest extent anybody who supplied drugs that resulted in somebody's death. Okay, so we worked very, very hard on that, and we had 4 successes within Loudoun County in probably about a year and a half. And then about a little bit more than a year ago, we had a deputy who lost her daughter to an overdose. Okay, so her daughter went to Florida with a boyfriend. He scored some fentanyl. They both took it. He survived. She didn't, and so we put a little bit of pressure on him, and were able to identify his source of supply for that. And we found out through the dark web and the way that the stuff was being received and distributed, that this individual was responsible for at least 3 deaths and maybe as many as 19. And because he was distributing, he would get the drugs in from China, and then he would distribute them throughout the country. And then you'd have people that were tracked back that actually overdosed and died as a result of the drugs that he distributed. So we charged him federally, working with our DEA office in Orlando, and working with the sheriff's office down there, and expanding the investigation nationwide. And because of that, a couple weeks ago, he was before the judge, and he got a life sentence for what he did. And I think he was really shocked at that, because all he's thinking he's doing is getting these things on the web and sending them out. And the next thing you know, he's doing life because of this, not really understanding or appreciating the fact that he took a lot of lives in what he was doing. So what we try to do is hit this from all angles. We do a lot of education at the schools. We've actually tried to enhance. There's a movie out there called Chasing the Dragon. I don't know if anybody's ever seen that, but it really hits hard, and it really is a message to the teenagers out there and to the parents to understand. And if you ever get a chance to see that movie, I'd highly recommend it. And if you go through the movie, you'll see that some of the people that were interviewed during the movie didn't survive until when the movie was finished. So they died along the way, even though they were interviewed, and they recognized that they had a problem and trying to get help, and some could and some couldn't. So I think that the key here is to address this issue across the board from every angle, whether it's our legislators, whether it's our trying to improve legislation and making sure that we're doing everything that we can to hold people accountable, and also protect people that witness this and can help out and maybe solve a problem. Everything that we can do from every angle is what we're trying. And I think, I can tell you that we've had some success. I was at a HIDA meeting a couple months ago, and we had out of the whole Baltimore-Washington region, Loudoun County was the only area where there was a marked decrease. At that particular point, we were 22%, we were 18% below where we were in overdose deaths the year before. And just about everybody in the whole Baltimore-Washington region had an increase of 50% or higher. Okay, so they had a 50% increase in overdose deaths, and we were down. And I think I can only attribute that to the fact that we've tried to hit this program from every possible angle, and I'm sure there's some out there that we haven't even thought of yet, and that's why it's great to attend these forums, because every time we have one of these things, we come away with some new ideas and some other things, and that's what we're trying to do. And we want to keep that program going, and we're out there to try to save lives and do the right thing. Thank you.
Dr. Bill Hazel is a senior advisor for strategic initiatives at George Mason University, where he's leading a university-wide effort to address issues related to addiction and opioids. He also, as you probably know, served 2 terms as Secretary of Health and Human Resources for the Commonwealth of Virginia. But before that, before becoming the secretary, he grew up in Fauquier County, graduated from Princeton with a degree in civil engineering, and then went on to Duke to get a medical degree and do an orthopedic residency at the Mayo Clinic. Before he got involved in these other pursuits, he had a practice in Northern Virginia, was the assistant surgeon for the Redskins and the team physician for DC United. He's been involved in many local, state, and national groups, and including serving as president of the Virginia Medical Society and trustee of the American Medical Association. In his 8 years at the Commonwealth, serving both parties, Governor McDonald as well as Governor McAuliffe, he oversaw 11 state agencies, including Medicaid, health, behavioral health, social services, aging, and rehabilitation. And in his first term, led the Health Reform Initiative, established the Virginia Center for Healthcare Innovation, negotiated a settlement with the Justice Department leading to the first training center closures, so many other things, and recognizing, established a coordinating council, co-chaired the coordinating council to address homelessness in Virginia. In his second term, he helped establish the Children's Cabinet to develop and implement a comprehensive policy agenda related to the well-being of our children in Virginia from birth to 21. He also co-chaired a mental health task force with the Public Safety Secretary and in response to the opioid epidemic. He's been a strong advocate for evidence-based policies to inform setting policies on all these important areas, and philanthropy to fund upstream initiatives with the goal of prevention. He and his wife Cindy are longtime residents of Oakton, and they have the good fortune to be near their 2 adorable granddaughters. Granddaughters. Thank you so much, Secretary Hazel, for being here.
Thank you. So, a couple of things. I've been known not to follow the notes very well, and you can look at the handouts that are at your table and see the numbers, but want to pick up on a couple of things that I think are important. And the big one is you're here. And if we're going to address this issue, we need to have some common understandings, and we have to work across domains. How often does one see a sheriff, someone from a behavioral health agency, and someone in recovery who is a convicted felon on a stage together? And it's domains, but there's also jurisdictions. As we look at this problem in Northern Virginia, great work. Every locality, Fairfax has a task force, Arlington, Alexandria, the cities of Falls Church, Loudoun, Prince William, Fauquier, everybody's doing this. And to a certain extent, we're spinning. We're getting some meeting fatigue already on a problem that is going to be with us a long time. So let me just talk a little bit about what the problem is coming from the state, a little bit what we did and where I think we need to go collectively to make this work, and perhaps how Mason can help with it if you all want. So the first thing is, this is a disease. There is no question about it, it is a disease. When you become addicted, when you have a substance use disorder, your brain does not work like it did before. However you got there, you may have made the wrong decisions as a kid. Somebody like me may have given you opioids after surgery, and it takes 48 to 72 hours for the brain to start changing after you get the opioids. Clearly, we were pushed to be more compassionate in medicine and prescribe more, and pain became the fifth vital sign. Anybody been to the hospital and they put the 10 smiley faces in front of you in the middle of the night and they wake you up to ask you if you hurt? And when you say yes, we don't have the opportunity to send you to yoga. So we prescribe pills. And roughly 80% or so of cases, it's been argued, start with medication, prescribed medication. Sheriff Chapman referred to the High Intensity Drug Trafficking Agency. I heard a gentleman who runs it for Appalachia say, there's just too many pills out there. And we chase bad guys, we don't chase doctors and nurses. But part of the reason we prescribe pills is because y'all ask us for them. And if you come to me and you hurt as an orthopedic surgeon and I don't give you the narcotic, you're going to go out on social media and say, he doesn't care. So think about what you're asking for. Think about how we get the pills off the street. But the brain does change. There's no doubt about it. The brain changes. And those people who get addicted, I was at Eastern Shore with the Lieutenant Governor last year, the year before, and he was showing a movie, and the gentleman got up in the back, African-American gentleman, a pastor at a church, and he was talking about it, about what happens to people. And I swear, that was when it hit me. It's like the devil hijacks your brain. These folks who, in interviews about treatment and what they've been through, will say, don't bother sending me text messages because I'm only looking for ones from my dealer. Call the people around me who can help me and get me to care. Because you get this single-minded pursuit of the one product that's going to make me feel good, and then after a while, just to keep me level. So it's a disease. It's not a moral failing, it's a disease. Second piece of it is there is treatment for it that works as well for this problem as it does for lots of chronic diseases. We have a chronic relapsing disease. Leukemia is one. Diabetes doesn't relapse. You typically get it and you have it. And we have medication for it, but it also involves lifestyle changes. So there are basically two ways people think about treating this, and one is an abstinence-only approach, and it works for some people. Diet changes work for some people who have diabetes. I doubt it would work for me if I had diabetes, but that's a different problem. Medically assisted treatment is the gold standard, and people say, oh, but you're giving somebody a drug to replace a drug. That's horrible, but the difference is the drugs that we give you to treat your cravings and help you feel normal also allow you to have a normal life. And that's really where we've got to go with it. Now, there are only three things that can happen to people who are addicted. Anybody remember Woody Hayes, the football coach at Ohio State? Anybody old enough? You're nodding your head. It's not rattling. That's a good thing. Woody Hayes, you say, Coach Hayes, why doesn't Ohio State throw the football? He says, if you can throw the football, three things can happen and two are bad. And when someone gets this disease, three things can happen and two are bad. The first thing that can happen is you can die. In many cases, that is merciful. It doesn't show up in Sheriff Chapman's recidivism figures because they're dead. They don't come back. But we need our people, folks. Our populations, morally, we need them. Our populations are decreasing. We need these people to be back being productive. We need Nick. We need Nick. The other thing is they don't get into recovery at all, and they cause harm. And let's think about it. Infectious disease, hepatitis, HIV, endocarditis is on the uptick from sharing needles. Anybody heard of neonatal abstinence syndrome, or what they call opioid-exposed infants? Women who are pregnant and using and their babies are born and withdrawing is an awful, awful thing. And by the way, when they are in the hospital recovering from this, these babies, who pays for that? We all do. If I ever ask you who pays for it, it's the call and response part of the sermon, you say we all do. So who pays for it? We all do, yeah. Oh, and when they go and steal, forge prescriptions and steal and commit crime to get drugs, and they end up with Sheriff Chapman's hospitality, who pays for that? We all do. That's right. And did you know that the major growth in kids coming into the foster care system is addiction? Yeah, it is. We've seen about a doubling of that since 2010, and it's a lifetime, folks. So we don't want them to die. We don't want to live with the harm. So the choice is treatment, helping people get into recovery with this chronic relapsing disease. And I don't think we as a society have even begun to realize that if we get people into recovery, which is where we want them, it's going to be a lifetime if we're lucky. And we have to design our public systems and our private systems and our family systems to support people in long-term recovery. And to understand that if they go off the wagon, it is not a moral failure. It is a disease that needs to be retreated, and we need to bring them back. Now, the challenge is that someone's gone through Sheriff Chapman's program, lives out here in Loudon, is doing well until they have the misfortune to be picked up in Arlington on their way back from D.C. with another substance. And they go to booking there, and nobody in Arlington has a clue that we already know how to help this person because our jurisdictions aren't aligned and aren't talking to each other. We need to work on that. That's going to take some political will and leadership, and political will comes when you all agree that it should happen. Okay? It's called sharing information when it's needed to help people. So there are really 5 categories, and we'll just point that up, but there are about 5 categories of things I think we can do. Number 1, we have to address the harm reduction. We have to address the infectious diseases and the neonatal abstinence and the foster care. When sheriff arrests a single mom of 2 kids, who makes the call to human services to say, go check on the kids? Are there kids? Who's telling the school that these kids aren't going to show up and gets them put back? And is it automatic? And is it wired into the program? We got to think through things like that. The next piece is prevention. You've talked about the messaging and getting to kids early and getting to families. We have made progress in Virginia. We've put in laws that regulate prescribers, reducing the number of pills. But if I had a patient who has this disease and I don't stop giving them their pills, you know what they do? They go to the street because the devil is still talking to them. And then they get something they're not used to and they overdose on it and die. Or we have to resuscitate them. So it's two-edged. There's nuance to this, folks. It doesn't work unless you're being nuanced. So we think about prevention in that way, education, prescribing. We think about expanding treatment. We need workforce, and that is not just doctors to prescribe pills and nurses to prescribe pills. It's people to provide this human supports. And that requires an investment on the public side that most of us often don't think about making. I have been a proponent of Medicaid expansion. I'm glad we have it. It should bring $200 million a year into behavioral health. Oh, and by the way, those same 3 things that happen for people who have substance use disorder happen when people have mental illness. They die younger. The exact same things, and we have these problems in Virginia, so think through that. Treatment is needed. The 4th piece, and what makes this so difficult, is because there is no problem in the health world, the Health and Human Services, where we have to interact with our law enforcement colleagues so much. because likely the sheriff is going to be the point of entry into the system instead of a social worker. And we have to be able to communicate. We have to be speaking the same language. We have to align, and we need them to weed out the bad guys, because they are out there and they are clever, and the stuff coming from China. And by the way, it's not just, this disease is not just opioids, and don't get hung up on that, because the opioid will go away and we'll have something else. We still have methamphetamine, cocaine is on an upsurge in Virginia. All of these are symptoms of the same problem. So our ability to work with the jails and the community to create treatment and opportunity is important. But let me get to what you can do, and that's the fifth part, and I think it's culture change that we need to think about. When we had a convening at Mason back in April, we had the 5 work groups basically, and virtually everyone came down to the issue of stigma. Hope is an important part of this. If someone gets into recovery and goes through the program and can't get a job and can't get a place to live, they can't support themselves, they can't support their families, who pays for that? Y'all learned, some of you did anyway. We all do, right? And so we have to be open-minded. We have to welcome the community. Nick, hate to use you as an example, but we need you back. And we need you paying taxes, buddy. Go at it.
So Secretary Hazel really gave us a great overview of everything. I want to tell you, in the General Assembly, it is a top priority for us as well. In fact, I have worked collaboratively with our administration as well as a bipartisan group of legislators, including Dave LaRock and Senator Jennifer Wexton, working with Jenny Lovett of the Chris Atwood Foundation to make sure that we are getting naloxone into the hands of the people who need it the most, helping them get the Revive training and then putting the naloxone in those new volunteers' hands so that they have it with them when their loved one needs it the most, so that they don't die in an overdose. But today I'm here to introduce you to one of my favorite elected officials today. He's my former state senator and now Attorney General. Mark R. Herring became the 48th Attorney General in Virginia on January 11th, 2014, and took his oath of office for the second term on January 13th of this year. As Attorney General, he is working to prepare the Commonwealth for emerging public safety threats, fighting for the fundamental rights of all Virginians, promoting a strong business environment, protecting Virginia's natural resources, and modernizing the office of the Attorney General. He is responsible for overseeing an office of more than 400 employees, including more than 250 attorneys, providing all legal services to the Commonwealth. Mark has been an attorney in private practice for more than 20 years. He got his start in public service as a member of the Loudoun County Board of Supervisors. And prior to serving as Attorney General, he served 8 years in the Senate of Virginia, representing parts of Loudoun and Fairfax right here in this community. Mark has lived most of his life in Loudoun County, where he and his wife Laura have raised their 2 children. And the Attorney General has made addressing heroin and prescription opioid addiction epidemic a top priority. He's utilizing a multifaceted approach that emphasizes education, prevention, and enforcement, along with legislation to encourage reporting of overdose in progress, expanding the availability of naloxone, and expanding the prescription monitoring program. He and his team have worked dozens of cases against heroin and fentanyl dealers and traffickers, brought enforcement action against doctors and medical professionals who overprescribe or steal drugs, and he continues to investigate the role of drug companies in creating and prolonging the crisis. And I am welcoming our Attorney General, Mark Herring. Thank you.
Thank you. Are you going to sit up here? Okay. Good afternoon, everyone. You want to take that? Thank you. And thank you, Jennifer, for the wonderful introduction. But more importantly, thank you for the great work you're doing on behalf of residents in this area and representing this community in the House of Delegates. And I absolutely love Richmond, and I love traveling around the Commonwealth, but there is no place like home. And it is great to be back here in Northern Virginia. As Jennifer mentioned, I've got, my roots to the Dulles region run very deep, and not only did I grow up in Loudoun, and Laura and I raised our family here, but as a county supervisor and as a state senator, I worked together with many of you in this room on a lot of issues facing our region in the Dulles area, from trying to work to revise our land use plans, to get Dulles Rail extended into Loudoun County, and in so many different ways. And so it's great to be back. And by the way, I feel that relationship with this region is something that I carried with me into the Attorney General's office. And now that we have, our second term is underway, I want you to know that I'm hoping that connection to this region and to the chamber, it only gets stronger as we move forward. As Attorney General, we cover a lot of areas. And today, though, I want to talk to you more specifically about one of my top priorities as Attorney General, something that every Virginian needs to know about and talking about right now, because every Virginian has a role to play in turning this around. And communities all across the Commonwealth and around the country are facing a heroin and prescription drug crisis that is claiming the lives of hundreds of Virginians every year. It's a problem that often has its roots in the medicine cabinet as opposed to on the street, and each one of us has a role to play in getting this turned around. In 2017, Virginia set a grim new record with more than 1,200 heroin and opioid overdose deaths, including 500 from prescription opioids. And the number is shocking, it's heartbreaking, and it's sometimes when you talk about the numbers that way, you lose sight of the fact that every single one is somebody who was loved and cared for by friends and families, and now all of those families are missing someone that they love deeply. Heroin and prescription drug abuse and the fatal overdoses that follow cut across all demographic divides. There is no typical heroin or opioid addict. It's not a white problem, a black problem, a Latino problem, an Asian problem. It's not rich or poor problem. It's not rural, urban, suburban problem. It is a national problem, and Virginia is not immune from it. And everybody is at risk, everybody. Something as simple as a sports injury or dental work, a back injury or surgery can expose a person to prescription painkillers, which can lead to a dependence and addiction. And when the pills run out, they often do something they never thought they would do. They would turn to the cheap, potent, and often deadly heroin available out on the streets. And heroin and prescription drug abuse are each problems in and of themselves, but the two are strongly related. The National Institute on Drug Abuse says that half of all young people who inject heroin started by misusing prescription drugs. And 1 in 15 people who misuse prescription painkillers will try heroin within 10 years. I can't tell you how many times I've heard stories like this. I've met so many people who thankfully are in long-term recovery, but they often say it all started with pills. And the thing that really breaks my heart is talking with a parent who has lost a son or a daughter in an addiction that often begins with pills and ends with a fatal overdose. I could share with you probably 100 variations of the stories that I've heard. Some of you may know Carolyn Weems, the Weems family from Virginia Beach. Their daughter, Caitlin, was a fantastic girl and young woman. Everybody loved her. She was a soccer star in high school. And playing soccer, she had an injury that led to some dental work and dental surgery, which led to legitimately and legally prescribed painkillers that she became addicted to and ultimately turned to heroin and ultimately had a fatal overdose, leaving a young child that her mother is now raising. And as I said, I have heard a variation of that story so many times all across the Commonwealth. So I want to share with you a little bit about what I'm doing as Attorney General. First of all, I'm doing everything I can in a multifaceted way that includes prosecution and enforcement, alongside education, treatment, and prevention efforts. Now, my team and I have handled 117 cases against heroin and fentanyl dealers and traffickers involving more than 667 pounds of heroin. worth more than $37 million on the street. These cases include 39 fatal overdoses, 47 non-fatal overdoses. We are also holding doctors and pharmacists accountable when they make prescriptions illegally available, and we are handling those cases every single week. We've got a huge education and prevention program aimed particularly at younger Virginians and their parents so that they understand how these drugs work and how dangerous they are. The centerpiece of that effort is an award-winning documentary called Heroin, the Hardest Hit, which some of you may have already seen or your kids may have seen over the last few years. It's available online. It's a story of Virginians telling their stories, and some of them lost that battle with addiction. Some made it through recovery successfully. Some are parents struggling with the loss, but it's also the story of how Virginia communities are responding to this crisis. We've also worked in a bipartisan way to pass life-saving overdose prevention bills, including a bill to make naloxone available to all first responders and to community organizations. And I have to tell you, the changes that I've seen among policymakers in the last few years have really heartened me. And you know, our politics today is very toxic, it's caustic sometimes, and it's easy to get cynical about it. But on this issue, it's something that we can be heartened about. 4 years ago, when we talked to legislators about it, the need for a Good Samaritan law, for example, or naloxone, we heard, well, that's just going to make more people use and be more reckless. Or we said, well, we need to spend more on treatment and recovery, and we heard people say, well, you know, that's their fault for using drugs. But, you know, together, we have worked to change how people view addiction and understand it is an illness, that it can happen to anyone. It is not a moral failing. And we've come so far today as a society in understanding that it doesn't make somebody a bad person. It can happen to anybody. Finally, today I want to tell you about the latest front in our fight against this crisis. And just a few days ago, we took one of our largest steps to date to address the roots of this crisis, which I believe run directly through the nation's medicine cabinets. And that is directly back to opioid manufacturers, especially and most notably Purdue Pharma, the maker of OxyContin. And on June 27th, I filed a lawsuit in Tazewell County Circuit Court accusing Purdue Pharma of using a mountain of illegal lies and misrepresentations to boost sales of its opioids and to deceive Virginians about the dangers of its drugs. For decades, Purdue Pharma amassed a fortune and built an empire on suffering and lies. Lies about the dangers of its drugs, lies about what the company knew, lies about its central role in creating and profiting from the opioid crisis, which has become the deadliest drug epidemic in American history. And it's an epidemic that is the direct and foreseeable result of Purdue's complex, large-scale, and years-long campaign of deception, and we are putting a stop to it. My suit alleges two underlying violations of the law: illegal misrepresentation in violation of the Virginia Consumer Protection Act and creation of a public nuisance. And at the heart of the Consumer Protection Act is a simple idea: you can't lie about your product. And that's doubly important when what we're talking about is a product that affects people's health. Despite its legal and moral obligation to tell the truth about its drugs, since 1995, Purdue has engaged in a sophisticated, deliberate effort to change norms around prescribing and consumption. And the lie at the core of all of Purdue's efforts is the false claim that their opioids were uniquely effective at relieving pain with little risk of addiction or abuse. Experience and science tell us that is false, and our investigation shows Purdue knew it was false. For more than 2 decades, Purdue's marketing strategy has tried to convince all of us that its drugs are effective, that they are superior to over-the-counter pain relievers, and that its opioids are safe and pose a low risk of addiction. So that's why I filed suit against Purdue, because I want the lies to stop. I want the misrepresentations about these drugs and their risks to stop. And I want the incentives to pump Virginia full of pills to stop. Most of all, I want the heartbreak and the loss of life to stop. And while the suit against Purdue is significant and it's an important step, That is actually just one part of our strategy and is only one part of our investigation into manufacturers and distributors. I've been working on a bipartisan, multi-state investigation into manufacturers and distributors for more than a year, and that work is going to continue. And we will bring enforcement actions when we need to protect Virginians and put an end to dangerous and illegal conduct. So this is a problem that is going to take everyone working together. We all have a role to play in talking about this problem with our kids, our friends, our coworkers. So many families from all walks of life have been and will continue to be touched by this crisis. Families who never in a million years imagined they would confront something like this, and yet now they're fighting something that feels so overwhelming. And for too many families, they're trying to find a way to carry on without a loved one. Getting to know this special but sadly growing group of Virginians has really driven my work on the problem, and I will never forget some of the stories that and people that I've met along the way. I've gotten to meet extraordinary Virginians who have changed my life forever, and you can never forget when you listen to a teenager in a group session, and I've gotten to know the recovery community really well and sat and listened in a lot of sessions so that I could learn more about this problem. And it is so heartbreaking to hear a teenager say that their friends are dead and they think these pills are going to kill them next. And someone, a parent, talking parent to parent to someone who has lost a son or a daughter. It's something that you can never forget. This really is a crisis. It's something that we all have a responsibility to try to turn around. And as Attorney General, I've got also a special responsibility to hold those responsible accountable. So thank you for the opportunity for letting me tell you a little bit about the work we're doing in the Attorney General's office on this, and I look forward to the questions in a minute.
Thank you so much. I've got a couple questions from the audience. So we'll start with you, Secretary Hazel, but certainly...
That way he can tell you what I meant to say with the answers.
Yeah.
Right?
Oftentimes, substance abuse disorder grows from mental illness, and then the problem is doubled. Where should people in this situation start in gaining the help they need?
There are lots of entry points. First of all, I think that mental health issues, addiction issues are both, in my mind, when I say behavioral health, is a subset that goes together. Now, unfortunately, the way the medical system is designed today, they will say, well, if you have a substance use issue, you need to get your mental illness cleared up before we can deal with it, and vice versa. The mental illness folks say you need to get your substance abuse issue, and you know what? It drives me crazy. And that's not a long drive, by the way. But the key here is to look for systems that are integrated and dealing with both. And that doesn't mean people are in the same office, it means they're in the same system. It will surprise you, but the public mental health system in many cases is far better at addressing these problems than the insured based private sector, because this is what our folks have been doing. I learned this when I was secretary as an orthopedic surgeon. You don't know these things. But these folks that you've heard from are doing the work in and out every day and have the systems in place. So if you have a problem that needs help immediately, call your community service board and if they can't handle it, if you don't fit their criteria, they can tell you who to go see. But that's a big entry point right there. Sometimes your doctor will know, many times they won't.
Thank you so much.
Well, and I'll defer to the doctor on treatment issues, but what I would add to that is, when we started this work, one of the things we wanted to do is try to inform everyone about the dangers of these drugs. But then we also heard from a lot of people, especially parents, who were afraid if they heard someone that they love, a son or a daughter, might be struggling with addiction, they were overwhelmed with fear of, oh no, then what can we do? And so we also had to couple that with making sure that the message about recovery is also a key part of it. You can't just talk about the dangers, because then if people find that they're battling addiction, they become afraid that there's nothing they can do. So we also have to make sure that we push that message about that recovery can be successful and how to get those resources. And so we do have a website that you can go to through our website to identify what resources are out there in your community around the substance abuse treatment.
One of the things that we're trying to do here in Northern Virginia is the state has tried to manage these problems in the public sector based on the state police districts, which puts us, Loudoun, Prince William, Fairfax, Arlington, Alexandria, and the cities all in one area. And one of the challenges is getting things aligned so you know who you have access to, and that's one of the roles that I suspect we're going to try to offer to play at George Mason. But the coordination too, in terms of diversion, is important, and where General Herring and I've worked together a lot the last 4 years was on, how do we address the issue? Because if you're the victim here, you're the user. He talked about the Good Samaritan law, and it probably needs to be updated and strengthened now. Yeah. I think it really does. But if you are the victim and the user, you really need treatment. And if you get into the sheriff's office, you may get it or you may not. The courts play a role in this, and we're big believers in having dockets that encourage treatment as an option to incarceration. When you have a carrot and a stick, it really helps. So there are things like that we have worked on.
Great. Another one, is MS-13 really a problem within our area dealing with drugs? How do drugs get here?
We are involved in a lot of different ways. This has to be a comprehensive approach. So yes, law enforcement has a role to play going after the dealers and traffickers, and we work with law enforcement, our law enforcement partners all over the state, our federal law enforcement partners as well. And it's come in a lot of different ways. Sometimes the precursor chemicals are coming from China into the U.S., then they're going into Mexico where they're put together and the drugs are made, and then shipped directly to the cities around the U.S. So there are a lot of different entry points, but we're working as cooperatively as we can, and this is something that I'm working with other state attorneys general on and coordinating some of those activities that cross state lines, because very often they do. But again, those law enforcement efforts, and we are not going to be, we're not going to let up on those. We're going to be relentless in going after the dealers and traffickers who profit off addiction. But again, this has to be a comprehensive approach, and education and prevention, along with expanded treatment, have to be key parts of it.
One thing that it may get lost in an audience like this is we think of it as one problem. And the supply chain issues are real. Heard a DEA, the chief of intelligence for DEA speak Monday on a panel with me, and now 80% of the heroin's coming out of Mexico. That didn't used to be the case. Fentanyl comes to Mexico, but you can get it through the dark web, shipped to your house from China. So there are multiple layers of the enforcement. But what you would need to know when you look at the state folks and say, well, what are you doing? We have to think not just about here, but we have to think about Appalachia. And in Appalachia, the problem is still pills. Okay, in Galax, Virginia, the problem is methamphetamine. In Fauquier County, which is interesting, they get a mixture of cocaine, methamphetamine, heroin, and fentanyl. It's dark on it lights up on all the different heat maps, and it's a different issue, locality to locality, and some of the distribution channels. If you're on the Eastern Shore, the heroin's coming out of Wilmington. If you're in Winchester, it's coming possibly from Philadelphia. So this is a complicated thing, but why, I'm so eager to see us understand the jurisdictional things is because we're kind of one market. And when somebody asks Sheriff about the TV ads, you can't run TV ads here market by market and have them be cost effective. You can't educate kids with different messages in Arlington and Alexandria. We've got to get ourselves on a similar message and take advantage of the scale.
That's great. I've got one last question that's a real gut-wrencher. A few days ago, an acquaintance overdosed. It was a suicide attempt. She was arrested in the hospital, complete with putting handcuffs on her wrists. She was told the arrest is mandatory for suicide overdose attempts. She'll be released after 2 days with no recourse or follow-up to help her. What should we do?
That is a gut-wrencher. Yeah, I just got a call from a friend whose son is in the jail, or was in the jail this week down in Saluda with schizophrenia, and has not been treated. And if someone, suicide is an immediate risk of harm to yourself, and you qualify generally in that situation for an emergency detention order, an evaluation by a magistrate, and theoretically, you should be getting an evaluation, psychiatric evaluation, mental health evaluation, and a referral to some sort of treatment in the system. That is a big thing. And let me just point out, suicide is something we hadn't mentioned, but I don't think that these problems of suicide and mental illness and substance use disorder are all that different in terms of some of the etiologies. If you look at the maps of this country where a lot of the issues are, some refer to them as a map of despair. And it's the hope piece of this thing that matters. And when you look at Fairfax, and I use Fairfax because it's the biggest, you look at that map, it does, in all the percentages, it's very low. You don't see this, but there are pockets that get lost in these maps. You have to zero in on neighborhoods and in census tracts to actually see where the problems are. Imagine Loudoun's got some of the same issues, but it gets lost. And even then, if Fairfax, wealthy county, looks like we shouldn't have any problems, but we still lost more people in Fairfax the last 2 years than any place else in the state. And when the federal government sends money out, they're not looking to us because our percentages are low, but our total numbers are high. But the answer there, something wrong happened there, I would tell you that. I don't know what the problem is. I don't know where that was, but I think we could look into it. Yeah. Something wrong happened there.
Yeah. And it's a story like that is tragic and heartbreaking, and whether it is changing the stigma around addiction, the same with suicide, we've got to have the conversations and discussions and look out for one another rather than turn the other way. Usually the people who are closest know that someone is having an emotional crisis, they need help. Don't look away when you see someone or know someone who is struggling, whether it's depression or addiction, but try to get them the help they need.
There is such a thing. Everybody know CPR? Anybody know CPR? Raise your hand if you know CPR. Do you know there's such a thing as mental health first aid? They teach it in Australia. Who knows about that? Go learn mental health first aid. You never know when you're going to need it.
Thank you so much. And we'll turn to you for, in a word, Secretary Hazel, in a word, how do you summarize this?
Nick took hope, so I'm going to say perseverance. Because this is going to take time, folks. And when the fad goes away and the federal attention goes away and the money goes away, we're still going to have to take care of our folks.
Thank you. Attorney General?
I would say urgent. This is truly an all hands on deck moment, and everyone's got a role to play here. You all are business people, all right? Well, check with you. If your business has an insurance plan, check to make sure that there's coverage for treatment. One thing that everybody can do to make your homes and your community safer. When you go home tonight, check the medicine cabinet. If there are unneeded medications, then look for the proper disposal location and site and do that and keep them locked up. And again, this is something that everybody's got a role to play, and working together, we're going to turn it around.
Thank you so much. Please join me in thanking our speakers.
It seemed to me obvious that any development should have its functional facets, but it also should have a fun, beauty, fantasy.
There's sculpture that's sophisticated for adults. There's sculpture that's playthings for children. And there are sculptures for different tastes, and yet they all belong and they all have a place. They're all fixed in situ in the environment.
Modern sculpture tended to be misunderstood. We felt that if we could take sculpture and make it useful and engaging, and especially make pieces of sculpture that had another role to play aside from being sculpture, we might succeed in making people love it more.
Reston is a very unique place. It has a really great tradition of public art and an approach to public art that was really ahead of its time in terms of integrating art and urban design and architecture and having the artists work really collaboratively on the design of public spaces.
It isn't that we had a piece of architecture built or someone did, and then we went out and bought art, to decorate it. Not that at all. We, the designers of the buildings and the builders of the place, together worked out the sculpture and the art, so that the sculpture and the art are very integral to the form of the buildings, the materials, and to the concept of the whole thing. When it came time to think about the idea of let's have some sculpture, Gonzalo Fonseca was an obvious choice. He had worked for me before. He also knew Rosant. And so we were all kind of part of a family and friends,
My father did this portrait of me during the time he was doing Reston. And so while he was doing these monumental projects, he found time to do this portrait. Father was born in Montevideo, Uruguay. He did attend 2 years of architectural school. Then he met Joaquin Torres Garcia, who was that great modernist, painter, thinker. He began experimenting with all kinds of sculpture, influenced by architecture, history of architecture, antiquity of all kinds, plus his modernist, constructivist training. I think Reston may or may not be the first instance, but it certainly is the most important instance of his kind of breaking into his own idiom. His work certainly was the result of so much digestion of great art together through the prism of his own understanding of modernism and his own incredible imagination. My father used to say that his work involves serious play. They're spontaneous and they're things to discover, hidden things, just the sort of thing that children love. Father was almost oblivious to the art world and yet supported himself, and his goal was to make the minimal, to keep going. Just before he died, he said, a lot of people want fame and fortune, I want time. It's the kind of man he was, the kind of artist he was.
Gonzalo Fonseca and my dad would go out to the beach, both in Italy and in Long Island, and they would do sand sculptures. And we had, little trowels and things. And these aren't like sand sculptures that kids make. These were pyramids. These were incredible creations, and they'd compete on the sand and do beautiful little steps that would circle a building. And when we, as kids, would go to Lake Anne after it opened, after it started, and see the sculptures, it was like walking into life-size sand sculptures. They were out of our imaginations of what my father and Gonzalo had built on the sand.
The fountain in the center of the plaza is designed as a play fountain in a way, so that kids of all ages really would not think of these things as sculpture primarily, but appeal to them more as something they played with and that made fun with water.
It's a fun sculpture and it makes the plaza full of laughter. Public art was essential in creating a public space. The shape of the plaza brings people to walk around it. The fountain invites kids to play. It's magical how it coalesces the whole plaza.
Between Rosat and Fonseca, we really got public art where we wanted it. Community is what it's all about. Community is the interaction of people. That's my definition of community. I don't know if anybody else likes that definition, but I think it is. Community is interaction. And plazas are designed to foster interaction.
To create Reston Town Center, we knew we wanted something different. It's not very often you have the ability to put in the center of a city, in essence. We had to do something that was very special and that attracted people's attention right away. We knew within the first few months of our planning back in '81 that a fountain was essential.
In 1989, I was proposed for a competition to make a fountain. They have few artists who proposed, and I made my proposal, which was very extravagant and very expensive also. But they went for it, and it was one of the greatest adventures. I made this precise model for the fountain, and I brought it to Italy. It took several months for them to carve that piece.
The bowl was done in one piece, and then the spiral was done in two pieces. And then it was all put together on site.
When I'm asked to intervene in a space and create something new for the space, what I want to bring to that space is what I would like to find myself in a space. It is a surprise. I would like people to come around the corner and say, what is this? Wow. It was a community involved with in commerce, communication, so there's a god for that. That's Mercury. So I decided to make the Mercury fountain. But this Mercury I made is not stable at all. I hired this model. He was like this, and I had to put pieces of wood attached to his arms and to his body for him to be in the exact position I wanted, you know. The economic situation was not good. He was trying to find his balance, you know. Mercury was unsure. There's a great feeling about fountains. A fountain is a source of life. Is water. I like the idea of public art that's human, closer to what human beings really like.
I think that was the key thing, doing that fountain. It gives you a sense of place and makes you feel good.
Public art is a major aspect of placemaking. It lends distinction, identity, that sort of, I don't know why it's great, but it feels kind of different and cool to be here. So I think public art can offer all of that to a place.
Any evening, probably 10 months out of the year, where you sit at Mercury Fountain, the fountain's there, you see people gathered around it, talking, kids playing, and they may be engaged with the piece of public art and they're aware of it, but everybody in that space
is feeling it. And that, to me, is one of the most wonderful things that comes with public art, the spirit of community that comes alive in a place like that. I began to think about public art in Reston, and the founding principles talk about art and beauty in our public environment. But to make sure that that continued, I began to pull the community together to do this.
Reston is very unique to have one singular advocate and visionary leading their public art program to continue on the tails of the successful work of Fonseca many years ago and to look differently at what would public art in Reston look like now in the 21st century. And I think they're off to a great start.
I was attracted to mosaics because of the solidity of the material. There's something about the sense, even though it's elusive, of the permanency of mosaic. If I had my druthers, I'd spend my life mosaicing empty walls on highways and freeways and underpasses.
So all of you are going to make little stars that I'm going to place throughout the big mosaic.
Valerie Thaberge and her husband, they engaged the school, they engaged kids. The kids actually participated in designing the art along with Valerie. What more can you say about Reston than engaging our kids?
That's a key component of what IPAR is doing with public art, is creating ways for people to have a meaningful connection to the art-making process and to learn.
We wanted energetic colors and colors that kind of represented colors on a flower, so we chose green, yellow, and orange.
We're going to do like a green rectangle. Okay. The smaller ones, and fill the rest in with red. Okay.
Well, the stars that the kids made were great, and it just shows you how unique and precious every child is, because each star was unique and precious. When the kids saw their work up on the wall, I mean, it was just the sense of ownership was very powerful, and the enthusiasm that they were part of this bigger project.
It feels really good. I feel like I've been a real part of something.
I have to agree with Noah. It feels like we really helped contribute to this.
When people approach the mosaic, I hope that they are energized and feel the sense of the power of life.
My hope for public art moving forward in Reston is that developers and members of the community continue to embrace beauty in public spaces and in our natural environments as we evolve over time to come.
I have often asked, what's the point of public art? What's the point? Well, what's the point of anything that's fun? To the extent that we can increase the pleasurable experience of living for other people, we've done something that's really very nice, very, very good.